Thanks. So our final speaker of today is Professor Uri Ashery from the Tel Aviv University, and he's going to talk to us about hyperbaric oxygen therapy, alleviates vascular dysfunction and amyloid burden in an Alzheimer's disease mouse model.
הנה הוא שרי, נכון? יופי, רגע, שנייה, תלחץ. רגע. עוד שנייה. עכשיו. תבדוק, תראה.
Till it's running, let me thank the organizer for inviting me and for really organizing a broad spectrum meeting. It's really nice to have, I think, beside the biomed also to hear about socioeconomical aspects, demographic aspects, pension, which is part of aging. And I'm also happy that to see that the Birax is back and running, and I hope to see a new call for a grant coming soon. So I'll speak today about the mechanism of hyperbaric oxygen therapy in Alzheimer's disease. And this is part of what we are doing in the lab. We are studying several types of neurodegenerative disease. And the main topic that I will discuss today will be the mitigating effect of hyperbaric oxygen therapy. We also investigate two projects related to Parkinson. And one of them is dealing in finding a new platform or developing new platform for diagnosing Parkinson by looking at the skin biopsies and looking for alpha-synuclein aggregate using super resolution microscopy. The second one is looking at the alpha-synuclein propagation, and these projects are sponsored by the Oftin Center, which is also very active in Tel Aviv. So I'll speak about the mitigating effect of hyperbaric. I don't need to elaborate too much about Alzheimer. I think we heard about it a lot. Just a minute. I think I'll feel better here. Let me just add on what we know about Alzheimer is that there is a link between hypoxia and Alzheimer. And we know that hypoxia accelerates the formation of plaques and tangles. It accelerates the neuronal loss and also neuroinflammation. And the way that we thought that we might be able to reduce hypoxia is to use hyperbaric oxygen therapy, or HBOT. HBOT is a medical administration of 100% oxygen in an environment where you elevate the atmospheric pressure. So under this treatment, patients are sitting in a submarine-like tank, breathing 100% oxygen, and we elevate the pressure to 2 atmosphere. What it does, it causes the solubility of oxygen to increase by 5-fold in the blood and in the tissue, allowing blood to arrive to different areas in the body and in the brain that suffer from less of oxygen. A couple of years ago, Shai Efrati from Asaf HaRofeh started to treat a stroke patient even years after the stroke and found that HBOT improved their neurological behavior. They continued later on and also treated the traumatic brain injury, so patients that had cognitive deficiency for many, many years. And after the treatment, which is 2-month treatment, 1 hour per day, they had the improved recovery. So at that stage, we thought that maybe HBOT maybe also has valuable therapeutic practice to other diseases which has hypoxia, and for example, Alzheimer's disease. And we wanted to understand both the mechanism of HBOT and also to see whether we can reverse some of the pathology that we have in a mouse model for Alzheimer's disease. At that stage, Ronit Shapira joined the lab, and most of the work that I will describe was done by her. And in the last 2 years and Nofar Schotlander and Maya Gal joined, and I'll describe some of their findings. So what we are using are different types of mouse models. I think this was already presented this morning. The 5xFAD mouse model is a mouse which has several mutations in APP and presenilin. They accumulate plaques like in a patient, and there are different other symptoms like behavioral deficit, inflammation, impaired neuronal plasticity, and also impaired blood flow. And I'll touch upon some of these. What we are doing is we are treating 4 or 6 month old mice in a special chamber that we have on campus. We treat them 5 days a week, 1 hour treatment per day for about a month or a month and a half. And after the treatment, we assess their behavior, physiological, pathological changes. And let me just start by showing some of the findings that we have on behavioral aspect. For those of you who are not from the field, we can measure increase or decrease in mouse behavior, for example, by using the Y maze. You put a mouse in the arena where he has 3 arms, but one of them is closed. He is exploring these 2 arms. And at a certain point, when you open the new arm, a mouse, which is a curious creature, will go into the new arm. And if you try to measure the time in the new arm, you can see that the wild-type mouse will travel and explore the new arm much more. If you look at the 5xFAD, you can see that they do not really differentiate between the 2 arms. But after the treatment, you can find that the new arm is explored more. And this is quantified here. The other thing that we wanted to see, and this cannot be seen here, is the effect on hypoxia, but is quantified here. We could see that in the hippocampus of these mice, there is a high hypoxic level in the 5xFAD mouse. And after the treatment, it is normalized back to control. So it does what it should do and reduce the hypoxic stress. What is the effect of the different pathology of Alzheimer's disease? Maybe before that, one of the major factors that is changing when we change the oxygen is HIF, which is hypoxic-induced factor. And we can see that it is higher in the 5xFAD mouse, and it is normalized to control level after the treatment. So this might be part of the mechanism. We are exploring it more at the moment. What are the effects on the pathological symptoms of Alzheimer's disease? It's a bit hard to see, but I hope you can see the red dots here, which are the A-beta plaques. And you can see that in 5xFAD, there are a lot of plaques. After the treatment, there is a reduction, both in the number, in the area, in the size of the plaques. Can you reduce the light a little bit? Not possible. Okay. So use your imagination, and it is quantified here. We can see the result. What is shown here is basically a statistic between 2 groups of mice that got the treatment or not. And we wanted to see whether we do detect changes in the plaque or other other processes on the same mouse. And we joined forces with Pavlo Blinder, who is doing 2-photon microscopy. We created glass windows on top of the head of these mice. We image them with 2-photon microscope, and with that you can see both the plaques, which are stained in live animal with metoxy, and also with the blood flow. We apply the treatment to the same mouse, and then we image the same mouse in the same area, basically looking for the same plaque in the same arteries, and analyze the differences. So this is how a brain of a 5xFAD mouse look like. As you can see, it's full with green dots, which are the plaques. And this is just zooming into the brain of about 200 micrometer. What happens if we treat or if we don't treat? So this will be a 5xFAD mouse without a treatment. You can hardly see, but you can, what I want to show you here, that there are a lot of dots here, which are the plaques. And you can see that if you don't treat the mouse, you can see many more plaques. And if you look at these 2 plaques here, you can see that they grow a little bit. I'll show you a quantification in a minute. If you take another mouse and you treat it, you can see that there are still a lot of plaques at the beginning, but the number of plaques is decreasing. And you can also look at the different on these 2, and you can see that there is a shrinkage of the size of the plaque. When we quantified it, what we found is as following. In control, so 5xFAD mouse, there is an increase in the number of the small plaques. And this is completely abolished during the 1 month of treatment. So the HBOT is preventing the appearance of new plaques. If you look at the big plaques, these ones, we can see that the size is more or less maintained in 5x without treatment, but the treatment caused a shrinkage or degradation of these big plaques. In order to understand the mechanism, we looked at different enzymes that might be involved, and one of them is insulin degrading enzymes, that what we found is that it's increased. It is partially affecting the degradation of the plaques. Another protein that is very important is the LRP1, which is involved in clearance of A beta plaques, and we saw that there is an increase in the activity in the level of this factor. Again, both suggesting that the HBOT enhance both the degradation and the clearance of the A beta plaques. Another option that we had, since we looked at the brain of this mouse, is to look at the blood flow. And if we zoom in on one of these arteries here, and this is a method developed by Pablo, they inject a fluorescent dye into the vein, and what we can see here are these black dots are the blood cells which are floating in this fluorescent dye, which is part of the blood now. And what we measured is the diameter of the different vessels and also the flow. What we found is if we look at the untreated mouse, so 5xFAD mouse, and you measure the volume, we found that the volume of the diameter of the vessel is shrinking within a month by about 10%, and this is prevented if you give the treatment. If you look at the flow, you can see that without treatment, the mouse blood flow is decreased, and if you give the treatment, there is a significant increase in the blood flow. So suggesting that the HBOT itself cause less shrinkage or help against shrinkage, and this increases the blood flow. We wanted to see that this is occurring also in different methods, and we use a regular confocal. Again, hard to see. We use SMA, which is smooth muscle actin, to look at the diameter of the vessels, and what we found is that the diameter is smaller in 5xFAD, similar to what we found with 2-photon microscopy, but there is a recovery or normalization after the treatment. We also found that the vessel wall is thicker or thinner in the 5xFAD, and this was normalized only, this is shown here, and this was normalized only in the cortical area. So this suggests that HBOT prevent the constriction of vessels and also allow increase in the blood flow. Finally, we wanted to look at the effect of neurogenesis, which I will not elaborate too much. What we found using double cortin is that the survival of new adult neurons is reduced in the 5xFAD mouse, and this is recovered or rescued after the treatment. So what I showed you so far is that hyperbaric oxygen therapy or HBOT is influencing several processes, physiological, molecular, and cellular processes. It enhanced cognition, it improved cellular blood flow, it improved metabolism, and if we look at the different effects, we found that it affects neuroprotection, neurogenesis, neuroinflammation, angiogenesis. We were looking for something that might be common for all these processes, and what we are suspecting and what we are checking now is that we are looking for effect on the mitochondria, which is the main organ in the cell that consume oxygen. And these are preliminary data that I'll describe at the moment. We looked at the balance between fusion and fission, which is altered in the Alzheimer's disease. And what we found, again, in preliminary data is that one of the protein involved in fusion, NRF2, is increased after the treatment only in 5xFAD mouse. This is something that we have to repeat, but it suggests that the mitochondria is involved. We also looked at the effect on the different complexes, and this is just to remind you, there are the complexes 1 to 5, which are involved in the electron transport chain. We did not find any effect on the complex 1, 2, and 3. What we found is again an elevation on one of the complexes, complex 5, and this complex is involved in ATP production, which makes sense. It is enhanced after the treatment, only in 5xFAD. Again, these are preliminary data and we have to repeat them, but we are now exploring into more details what is the effect on the mitochondrial and biogenesis and activity. So to sum up, I showed you that HBOT has a multifaceted effect on several pathways. It reduces hypoxia, improves behavior of AD mice, reduces amyloid load, reduces inflammation, attenuates the reduction in vessel diameter, induce neurogenesis, and might affect mitochondrial activity. And we are suggesting that ABOT may present a novel therapeutic intervention for AD. In the last couple of years, several papers came showing a really improvement effect on Alzheimer's disease and vascular dementia patient. In this paper, a cohort of vascular dementia patients showed improvement in cognitive performance after HBOT, and in the paper below, hyperbaric oxygen was shown to improve a mild cognitive impairment patient for 3 months at least after the treatment. So there are some hope in this direction. At the moment, we are trying to understand what are the mechanisms and the effects on synaptic plasticity. We would like to expand our understanding on the effect of mitochondrial function. Gender-wise is also something that we are looking at. We want to understand whether there is an increase in the oxidative stress or a decrease. And we're trying to understand the molecular mechanism, and probably T14 will be something that we'll measure after this morning talk. Several other important questions that we have is for how long this effect is maintained. We know that for a stroke patient, if you treat with HBOT for 2 months, it lasts for many years, but neurodegenerative disease is something that is progressing, so we might need some maintenance. And another thing that we would like to do is something like a dose response to understand whether we really need 2 atmospheric pressure, 100% oxygen, or maybe 1.5 will be enough. That will be less risky, less toxic, less expensive. So I think I will skip this one since I summarized. Let me just thank the students who were involved. Most of the work was done by Ronit Shapira, Nofar Schotlander, and Maya Gal joined in the last 2 years. Irit is coordinating all the project in the lab, and as you can see, this project was done as a collaboration between many, many labs. And thank you for your attention. Do we have time for questions?
Thank you, that was great. Do we have any questions? Otherwise, I wanted to ask something. So I was wondering if you see any changes in the...
Oh, yeah.
Sorry.
Please go ahead.
Oh, no, I just wondered if you have any changes in permeability in the blood-brain barrier in your models, and do you see an improvement in this if you do?
Improvement in what? I did not hear you.
Do you see any obvious leakiness at the blood-brain barrier? Because you're able to image blood vessels and blood flow, so I wondered if you're also able to see any extravasation of plasma cells into the parenchyma.
We haven't checked it yet.
Okay, thank you. That was beautiful.
Hi, so my name is Shachaf, and I'm finalizing my master's at Sagol School. I've worked in my master's with 5XFAD mice, and it is known that this model is problematic sometimes, and it concentrates on the genetic mutations that are affiliated with only 5% of Alzheimer's disease patients. So I wanted to ask if you tried it in a more inclusive model, perhaps like the ApoE4, that has more similarities to the human patients.
We tried it on the triple genic as well, and we got a similar result. We have some preliminary data on the ApoE4, but we need to finish analyzing it. And you're correct that this is representing maybe 5% of the overall AD patient, and we need to be aware of it.
So you mentioned the effect on the arterioles diameter, but you also mentioned angiogenesis. So I was curious to know if you found new blood vessels, in which part?
We did not find new blood vessels. Angiogenesis is part of processes that others have been describing. We did not see any effect. Do we have time for another question? I think there is another one.
Can you use HIF1 alpha inhibitors to mimic the phenotype?
It's a good question. We haven't tried. I'm not sure that what I showed you is really what's going on, since the hyperbaric therapy is basically a fluctuation of increase in oxygen and decrease every day. So I assume that if you look at the daily changes, it might work, but what I showed here is really after 4 or 5 weeks. So I'm not sure that the inhibitors will mimic it as well. It is the fluctuation that is, I think, also very active, very important. Thank you.